This is a special report from News 3 WSIL.
Hello again, I'm Mark Kiesling. Tonight we continue our COVID conversations. We've been looking at COVID-19's impacts across our region and what that means for you. And for that, I turn it over to my co-anchor, Julie Williams.
Thank you, Mark. We're joined tonight by Dr. Jason West, a primary care physician with SIH Harrisburg. Dr. West, thank you so much for being here. We appreciate it this evening. And now we kind of want to focus tonight on substance misuse during the pandemic. I think a lot of people, myself included, we hear, COVID-19, we think of the virus itself, but there are a lot of mental impacts going on right now.
Absolutely. Just like we see a lot of chronic illnesses being impacted because of the pandemic, because people maybe haven't sought out care or because of the stress of the pandemic, and those got uncontrolled, whether it be chronic migraines being worse, whether it be diabetes being slightly worse, blood pressure being higher. We see the same thing with substance use disorders. They're being slightly less controlled, people perhaps using substances more than they used to, and it's been quite a bit worse. It was interesting. The CDC put out a study in the early months of the pandemic in 2020 showing that by May of 2020, approximately 15% of Americans had either started a new substance or started using substances more than previously because of the pandemic.
And are you seeing that, with your existing patients and even new patients having to come in?
Absolutely. We're seeing more patients come in saying, I feel like I'm smoking more, I feel like I'm using opioids more, I'm drinking more, or perhaps they're just saying, this has become a problem. My loved one feels like it's a problem, or I just need help and I want you to help me.
And so they can come into, a physician's office and say, I'm not sure what to do right now.
Absolutely. The mindset with substance use disorders used to be you have a personal problem, it's a behavioral problem, you just need to get your act together. We don't look at it that way at all. We don't do that with diabetes, we don't do that with blood pressure, we don't do that with migraines. We see those as chronic illnesses, and the same holds true with opioid use disorder, a tobacco use disorder, alcohol use disorder. We really see that those as chronic illnesses, and we say, we can help you with not just counseling, but also medications. And we want you to come in so we can serve you and make sure that those illnesses are treated and treated appropriately.
And are there predetermined factors, maybe, someone's genetic makeup that might make them more prone to, substance misuse, especially right now?
Absolutely. So again, it's not just you made a bad choice and you keep making it. It is a complex interplay between someone's environment, their genetics, and also just what's going on around them. And so oftentimes we see folks that have perhaps come from a home where they've had some adverse childhood experiences, perhaps someone's under a lot of stress, perhaps there's concurrent mental illness that's occurring. Maybe they've been involved in the justice system. There's all kinds of things that are at play that contribute to this. And so it's not just as simple as, well, you just need to stop. It's a very complex system that's causing someone to have this uncontrolled disease. And especially in the midst of COVID when we're all stressed out.
Big time. And if someone at home right now is watching and, kind of wondering, is this something I might be struggling with? What would you say to those folks?
I would say start to ask yourself, am I using, opioids? Am I using alcohol more often than normal? Am I unable to cut down? Has anyone started to say, this is kind of a problem for you. This is getting in the way of our relationship. And if it is, then I would consider reaching out to your local doctor. Consider reaching out to your health department. Specifically, the Illinois helpline is available for those that feel like opioids are a specific problem for them, and it helps link patients up to care or potential resources to help with prevention of fatal overdoses.
And I want to clarify too, because personally, when I hear substance misuse, my mind goes to alcohol, but it can kind of include anything, right, or be all-encompassing?
Yeah, that's a great point. So oftentimes we focus on one substance, but it absolutely encompasses things like tobacco, alcohol, like you mentioned. Opioids is the major one that we focus on right now, especially with the spread of fentanyl right now. I know that the story was run several nights ago about the spread of fentanyl and how dangerous it is. It's 50 to 100 times more potent than morphine. And so as a result, overdoses from synthetic opioids like fentanyl have increased 2,000% since 2013. I mean, it's horrific. And so, you know, we see that. And I'll tell you the other substance use disorder that we see frequently that is not considered a problem, but it is marijuana. A lot of folks have developed a marijuana use disorder because they think it's a benign thing, but it can really cause serious problems in their life. And I see that on a regular basis.
And what kind of treatments are available for anyone struggling right now?
Well, so it depends on each of the different substances, but one of the benefits of research and where we're at in today's medical world and our advancements it's not just counseling. We now have medications to help. So for example, take the opioid epidemic that we're living in. You know, I mentioned about all of the overdoses. There's medication that can help. So at SIH, we prescribe buprenorphine. It's a medication that can prevent those overdoses. It can alleviate people's withdrawal symptoms. It can alleviate cravings for opioids. And it's a life-saving medicine that people can take, and it prevents them from returning to drug use. And it's a really helpful medication. For alcohol use disorder, there's other medications that can also help. And so we don't just say you need counseling, but we also treat it as a chronic illness with medications as well, just like we would with diabetes or migraines.
Yeah, you make a fantastic point. It is still something that needs to be cared for and treated. Wow. And you know when it comes to therapy, I think sometimes there is a little bit of a stigma about it too. What would you say to that point tonight?
I would say that just remember that it's a chronic illness, and when we change our mindset about that, we recognize that it's okay to receive all different types of help, and that therapy is one of those helps, and it's really beneficial to talk about this. Now, one of the new things that we've recognized with substance use disorder treatment is therapy is not always mandatory. In fact, sometimes it's helpful to receive medication, and some patients say, well, I've been through therapy 10 different times, and I don't want to do it. I'd much rather receive medication. And we're okay with that, especially if the medication is life-saving. Yeah. We don't want to put up barriers to folks that want to receive care. It's much more important that they receive care. And so therapy is not mandated, but it's helpful. Just like, again, with diabetes, we don't mandate that people see a dietitian to get their insulin. We still prescribe the insulin. And so I encourage people to receive counseling, but certainly not a have-to part of their treatment.
And being that we are in a pandemic right now, there are still people, you know, who are scared to leave home, or extra precautious, I should say. Are there resources, you know, online or telehealth for any of this kind of treatment? Yeah,
I'm so glad you mentioned that, Julie, because we have really utilized telehealth at SIH to ensure that people can receive treatment while they're at home. I can't tell you the number of times that I've had a patient say, I'm quarantined because of COVID. I have COVID, my kids are at home, I'm just not able to make it, and we don't want to withhold treatment. We don't want that patient to run the risk of having an opioid overdose and dying simply because they have symptoms of COVID and require a test. Because of telehealth, we're able to prevent an opioid overdose and test them for COVID. And so telehealth has really enabled us to provide in-home treatment and prevent the spread of COVID.
All right, well, Dr. West, this has been a very enlightening conversation and very helpful information for us. So thank you so much for joining us tonight. We will have this entire conversation on our website, WSILTV.com.